Tired of trying many medications that either cause side effects or just don't work? Wish there was a shortcut to the perfect medication for you. Now, just one simple cheek swab, we can unlock the secrets of your DNA and tailor just the right medication for you. No more trial and error. Really? All right, friends, that sounds way too good to be true. But is it? You may have heard such ads, either on the internet, TV, or even from one of your prescribers. So today, we'll be discussing genetic testing for psychiatric medications. What can it actually tell you, what it can't tell you, and why it's not the magic solution it's too often advertised as. So let's get started. Hey friends, welcome back to Shrink Talk with Dr. Robert. It's by me, Dr. Robert, a board-certified psychiatrist. And in today's video, I'll be talking about pharmacogenetics, basically the intersection between medications, genetic testing, and yes, marketing. Basically, this little swab that you take, provided by your doctor, or sometimes it's mailed, and you rub it around your cheek, send it back in, and then they check your DNA. And what they're looking for are specific genetic markers that tell you whether you have certain increase or decrease in metabolism of certain enzymes in your liver. And these enzymes are known to break down certain psychiatric medications. These enzymes have fun, creative names like CYP2D6, CYP2C19, of course the C3PO R2D2 enzyme. I think I got that one right. Once you send the kit back with your DNA, they'll analyze it and they'll give you back a report, both to you and your doctor, whoever prescribed that kit. Basically, it's like a 23andMe of your medicine cabinet. But instead of being 2% Scandinavian, you're a slow metabolizer of Prozac. And the reason this is possible is because these certain gene sequences, or these parts of your DNA, basically what they do in your body is they tell your cells in your liver how much to create of a certain enzyme, or how that enzyme may work or not. And because these enzymes are what we call polymorphic, there's a lot of variation from person to person and group of people to group of people. And that can allow us to better determine which medications may be quickly or slowly metabolized. Think of it like kitchen blenders. Some people have like a NutriBullet, which you can blend things very quickly. So those are enzymes that can just turn through medications very quickly. And so a certain dose of medication will be metabolized very quickly, and so you may need a higher dose. And other people have an old college blender of a liver enzyme whereby things are churned through much more slowly, and so the medication, the same dose, can build up to much greater quantities because it's used up and blended much less quickly. In this analogy, right, same recipe for every person, recipe being the medication, but different results depending on what kind of blender liver enzyme metabolism they have. Yeah, I could go for a smoothie now. The Prozac Lexapro smoothie. So what do these tests actually tell us? Well, like I just mentioned, it means that if you're a slow metabolizer of a certain medication, you may get certain benefits, but also side effects at lower doses than expected. But if you're a fast metabolizer of a certain medication, you may just need a higher dose than expected to achieve the same result. It can also be very useful in determining if there's going to be a likelihood of drug-drug interactions. If you're a certain fast or slow metabolizer of certain medications and you're on multiple at once, it could be very useful for that as well to let you know, hey, be cautious of using these together. So next, what can't these tests actually tell us? Well, first and foremost, these tests cannot tell, absolutely not, whether a certain medication will work for you or not. That's the biggest misconception about them. So this test will not tell you that maybe starting sertraline as the first SSRI will be best for you, or Lexapro or Prozac. It can tell us maybe if you have a very unique, very high metabolism of something, that might be useful. But overall, it will not tell you which one's going to treat your depression, your anxiety, your OCD. It has no bearing on that at all. Again, that's going back to the fact that it only tells you if you're a slow or fast metabolizer, but not if it'll work or not. That's a very, very important distinction. It also can't tell you if you'll actually get side effects or not, or if you do get side effects, which ones you'll experience. Again, this is because mental health, we believe, right, takes place in the brain and the mind and the nervous system, and all these tests tell us are about liver enzymes. So these tests have no ability to fully capture actually what kind of mental health processes are going on, which medication will be best to tailor to your symptoms, or what to exactly expect. So why does this sound so much better than it actually is? Well, let's be honest, the appeal is huge, right? If you could just bypass the whole trial and error part of trying a psychiatric medication and just go straight to what works, that would make your life, my life, everybody's life much easier and simpler. But unfortunately, we're just not there yet, not even close. And if you've personally experienced the SSRI merry-go-round, trying various ones, having side effects, no benefits, then this sounds like a very appealing option. So I get the desire for people to have anything that they can gain in helping them decide earlier on what will be useful to them. But when you actually take a look at the evidence, look at studies that assess the quality of being able to predict an actual medication regimen using these genetic tests, the results are actually very, very mixed. Some studies show little to almost no benefit at all. Of course, you might have heard some areas where genetic testing can be very useful in choosing a medication. So for example, if you have a bad infection, doctors will swab that infection, get the genetic results off of that bacteria, whatever's causing the infection, and then tailor a medication regimen of antibiotics to specifically target that infection. And that can be very useful. That actually works out pretty well much of the time. So there are uses where this is much more effective because the process that we're looking at is much, much more simple. Choosing an antibiotic is orders of magnitude more simple than choosing which medication will be helpful for your mental health, because infections are much more easy for us to understand. There's a much more of a one-to-one correlation of there's this genetic vulnerability in the bacteria, so we give this medication that attacks it, which is very different than looking at a mental health symptom, which is orders of magnitude more complex than any infection, and figuring out what kind of medication, which is still poorly understood how it even works, may be used and fit appropriately to treat that mental health symptom. And on top of that, people are just way more complex, right? There's so much more at the intersection of mental health symptoms. Everything from our context of our lives, our traumas, our upbringing, our current relationship and stressors, our prior experiences of mental health symptoms, all this sort of flavors how we experience trying a medication, addressing our mental health symptoms. So it's far, far less of a one-to-one relationship where you can actually choose an enzyme and a medication. It's just not that simple. Probably won't be for a very long time. Why might they not be appropriate on the first appointment? And I would say that would be because when you're first coming in, trying a medication for the first time, this kind of genetic testing may, one, give some false hope as to actually what it may do for you. It's expensive, it takes a lot of time, insurance doesn't always cover it. And on top of that, it really shouldn't guide your prescriber's decision-making, because the idea with starting any psychiatric medication, if that's part of the treatment plan, is to always start at the lowest possible dose and go up slowly. And as long as you do that, no matter what the genetic testing tells you, you should be pretty well off. Because again, you'll be starting at a low dose, so even if you're slow metabolizer of a certain medication, that should still be okay. And it just might mean you might get a huge benefit from a very low dose. So there's huge potential to miss the opportunity of using a medication that might be very effective for you, but because you were skewed at first by the genetic testing results, you might not reach for it ever. But these tests do exist. So when is it a good time to actually reach for them? Well, I would say there's a specific, unique patient population where I think these might be appropriate. I would say that definitely if someone's experienced a lot of side effects, had a lot of trial and error, which isn't that common to experience that degree of trial and error, but if it does happen, a genetic test might be a useful tool to kind of determine some guideposts as to which medications to try next, which ones to pull back on or go up on. Especially when I have people coming in and they've been having a lot of medication trials, even at low doses they experience side effects, then this might be a useful tool. Or the opposite happens. They try all these high doses of everything, or seemingly high doses, but nothing is really having the impact or even causing side effects. Then that might alert me, hey, they might be very high metabolizers. Still don't necessarily need a genetic test. I would just go up on the medication and we can assess if there's benefit, side effects as they arise. But a genetic test might give us more confidence to be more aggressive than we otherwise would. So when it comes to these swab tests, they're more like a compass, not a GPS. They won't tell you exactly what will be helpful, what won't, but can give in certain situations some useful markers as to how to proceed. All right, my friends, thanks so much for sticking around to the end. I really appreciate it. I look forward to giving you guys another mental health video next week, and please leave comments down below, like and subscribe, and support the channel. Thanks so much. Yeah, definitely gonna start off with a Zoloft.